Welcome to KV Nursing Tutorials. Today we are going to deal with midwifery and gynecological nursing, that is obstetrical and gynecological nursing. So this is very important in case of nursing competitive exams. So in this, one of the most important topic is menstrual cycle. So first one is definition. The cyclic event that takes place in a rhythmic fashion during reproductive period of a woman's life is called menstrual cycle. The menstrual cycle is a series of changes that endometrium of the uterus goes through as it prepares to provide a protective environment in which a fertilized egg will be settled. So here settles the development into the baby. So if a woman does not become pregnant during her menstrual cycle, the thickened lining of the uterus down and its remains trickle out of the vagina during menstruation. So that is called menstrual periods. So this month bleeding is one of the few signs that is menstrual cycle is taking place. So the menstrual cycle is controlled by changing levels of estrogen and progesterone released during the ovarian cycle. So the menstrual cycle can be divided into 3 phases, that is length of the cycle is 28 days. So first phase is menstrual phase that lasts from first day to 5 days, and proliferative phase 5th day of menstruation to 14 days. So secretory phase 14 to 28 days. So coming to the first one, that is menstrual phase. So in this menstrual phase, the beginning of the cycle is marked by the menstruation or the menstrual period with low levels of progesterone being produced by the ovaries. The blood vessels supplying the thickened wall of the endometrium will be getting constricted. Because of that deprivement of blood vessels, the wall starts of fragment. So this is a menstrual phase. And menstrual flow that passes out of the vagina from the uterus consists of tissue fragments and blood. And the second one is proliferative phase. So in this 5th day of menstruation to 14 days. So most of the proliferation phase will be because of estrogen released hormones. So here in proliferative phase, estrogen released by the ovaries stimulates the repair and growth of the endometrium so that it proliferates and begins thicker and more spongy. On 14th day, ovulation occurs under the influence of LH, that is luteinizing hormone. So in third one, so that is the last phase, that is secretory phase. This lasts from 14th day of menstruation. So that is 14 to 28 days. So after ovulation on the 14th day, release of estrogen and progesterone from the ovaries, that is corpus luteum, stimulates. So because of the stimulation of corpus luteum, endometrium will be getting developed further. Means here for next menstrual cycle, for the next period, so it will become thickened. So after that, in this only blood vessels will be getting increased considerably, and it provides a fertilized egg with a receptive, nutritive, rich environment and in which to grow, and again it will be getting prepared for the next phase, means in the coming next month of periods. So this is called secretory phase. So you can have the picture view over here. See here, coming to the ovarian cycle, so how growing follicle is getting developed from small dot to bigger one. So next one is ovulation, and next is corpus luteum, and the next one is corpus albicans. So based upon, it depends upon body temperature, that is 36 degrees to 37 degrees Celsius. And the next one is anterior pituitary hormone. So it is based upon 2 hormones. So mainly these pituitary hormones will be releasing female hormones, that is LH hormone and follicular stimulating hormones. So the next one is ovarian hormone, that is called estradiol and progesterone. And coming to uterine cycle means from starting first day of menses, that is follicular phase. So 0 to 14 days. So 14th day is considered as ovulation phase, and soon after completion of 14th days, that is 15 to 28 days, considered as luteal phase. In this phase, proliferation will be getting start, and moreover secretory phase means it is going to stimulate endometrium for the further coming periodical cycles. So this is regarding the secretory phase. And if in case of fertilization does not occurs, so corpus luteum will be getting breakdown and endometrium starts to disintegrate and cycle comes to the end. So if in case of fertilization occurs, so the corpus luteum receives hormonal message from the newly implanted embryo. So because of that newly implanted embryo, so this hormones level will be getting increased, and that is HCG hormone will be telling no. So in case of pregnancy, yes, so pregnancy will be getting confirmed. So this is regarding menstrual cycle. So please do share and subscribe KV Nursing Tutorials. Thank you.